I'm Dr. Arnie Vainio, and today we'll be talking about DVTs. A DVT, or deep venous thrombosis, is when a blood clot develops in a vein. Veins are the low-pressure blood vessels that return blood to your heart after it brings oxygen to your tissues. Most people who get DVTs have risk factors like cancer, trauma, major surgery, birth control pills, or pregnancy. When someone gets a DVT without any risk factors, it's called an unprovoked or idiopathic DVT and is treated differently. DVTs form in different places in the body, but are most common in the legs, and that's what we'll talk about today. Most DVTs don't have any symptoms, but when they do, it's because of impaired venous blood flow due to that clot. There may be sudden swelling and or pain in one leg, dilatation or swelling veins on the surface of the leg, and red or discolored skin. Diagnosis depends on finding the clot in a deep vein, and we look for them with ultrasound or CT scan. Clots that form in superficial veins don't carry the same risks. For instance, clots in veins just below the skin, like varicose veins, are called superficial thrombophlebitis and are not DVTs. Clots deep in the calf muscle, in the large veins in the upper leg and pelvis, are considered DVTs and need to be taken seriously because they can break loose and travel to the lungs. DVTs are either chronic, subacute, or acute. Chronic or subacute means the clot has been there for a while, is denser, and the blood vessel is not expanded. Acute or new DVT means the clot is more soft and compressible, and the vein is usually larger than the vein on the opposite leg. Every year, 1 in 1,000 adults will develop a blood clot. Approximately 2/3 of these are DVTs, and about 1/3 are pulmonary emboli, or PEs, which are clots that have broken loose and traveled to the lungs. As people age, the numbers rise, and the overall incidence is going up because people are living longer and testing for DVT is getting better. Your body's blood clotting system is really complicated, but the three main reasons DVT and other clots happen is due to a thing called Virchow's triad. This is a combination of venous stasis, endothelial damage, and a hypercoagulable state. Venous stasis means blood isn't moving well, such as during long car, train, or plane rides. Endothelial damage means injury to blood vessels like during surgery or from injuries. A hypercoagulable state means anything that makes blood clots happen more easily, as in pregnancy or inherited blood clotting disorders or cancers. Hospitalization DVT is unfortunately common, and that is a DVT that happens during hospitalization or within 90 days of hospital discharge. Good news? There are brand new medicines to choose from, but those choices depend on things like a patient's kidney function, liver function, pregnancy, cancer, obesity, and bleeding risk. Some DVTs are treated for 3 to 6 months, but other people need to stay on medicines for years. Non-traditional tobacco use? You knew this was coming, and avoiding a DVT or a blood clot in your lungs is a great reason to quit smoking. There are many programs and medicines to help with this, and no one said it would be easy. As always, if you can't stop smoking for you, stop for the sake of your children and your grandchildren. And don't forget to call an elder. They've been waiting for your call. I'm Dr. Arnie Vainio, and this is Health Matters.